So hello everyone. Today we'll be talking about dengue virus. So dengue virus is caused by Aedes aegypti. Aedes aegypti is a mosquito which causes dengue virus, and dengue virus is divided into four stages: dengue without warning signs, dengue with warning signs, severe dengue, and dengue hemorrhagic fever. So this severe dengue is actually known as dengue hemorrhagic fever, and then you have dengue shock syndrome. Okay, so what happens in the dengue without warning signs? In the dengue without warning signs, remember that there is a high grade fever. There is a high grade fever of 40 degrees Celsius. So there is a high grade fever of 40 degrees Celsius. You can see in this man, what you can see is, you can see that a bone is being broken. So over here the photo is, I'm just magnifying that area. So I've made a broke bone. Okay, so this is known as a broken bone fever. So it's very painful. Okay, it's very painful to the patient, and there is high grade fever along with myalgias, arthralgias. Okay, and you can see that I have made a picture over here, that I have made that a person is there, and a person in the body of the person, someone is keeping the hand, and that hand and there is a basically erythema, and when you just put your hand, it will lead to blanching. So blanching feature is seen with the case of dengue. So it's a blanching rash, and there is generalized lymphadenopathy, and it is described as islands of white in a serrate of sea. So you can see here how have I made. So you can see here that islands of white in a sea of red. It's given like that. So it's a high grade fever with severe headache, retroorbital pain, myalgia, arthralgias with maculopapular exanthem, measles like rash, and generalized lymphadenopathy, which can be seen in the case of dengue without warning signs. Okay, so it's like measles like as an exanthem can be seen. There is a blanching rash, and there is a islands of white in a sea of red. Okay, so that you need to understand. And there is something which is known as a positive capillary tourniquet test or fragility test. Positive capillary fragility test. So what we do here is, suppose we take a BP cuff, we put it here, and then we inflate it in between the systolic and the diastolic pressure. Just keep it for 5 minutes, so 5 to 10 minutes. Okay, so you can see there is some petechiae. Okay, that is a petechiae per square inch. Okay, petechiae per square inch on the forearm will give you the diagnosis of dengue. So petechiae per square inch on the forearm will give us the diagnosis for dengue. Now you need to remember that never ever give corticosteroids in dengue. Remember, more than 10 petechiae per square inch on the forearm is the diagnosis for dengue without warning signs. Okay, now remember, dengue is classically, there is thrombocytopenia in dengue. That is very important. Now we will be talking about the treatment in the next page. Let's talk about the dengue with warning signs. In dengue with warning signs, what happens is that the patient already had dengue. Now there is a superimpose another serotype. Sorry, I'm very sorry. Here what is there is dengue. Okay, there is dengue, and the person is with severe comorbidities. So there might be diabetes, there might be immunocompromised person. Okay, you might be an immunocompromised person, or there might be other features. Okay, that will actually correlate with this feature. Okay, so there is the person will have severe comorbidities. Suppose he might be an infant who is less than 1 year of age. Okay, or he might be having a history of previous dengue infection. So he have had infection in the previous years. Okay, and now the infection has been exaggerated. Okay, so he has a history of previous dengue infection. The infants less than 1 years of age, and at risk patient with fever with severe comorbidities. Okay, now dengue with warning signs. In the dengue with warning signs, what you need to understand is, it occurs 3 to 7 days after the symptom onset. Warning signs appear after fever subsides. Okay, so there is warning signs that appears after the fever subsides. So after your fever subsides, the warning signs appear. Okay, and the at-risk population I have already told you. And now look into this beautiful diagram which I have made. I have made this green color vomit, I have made this liver which is enlarged, and I have made ascites, and I have made this pleural effusion. So all these features will be seen. Okay, so there is abdominal pain, there's persistent vomiting, there is enlarged liver, there is fluid leak to the third space like pleural effusion, ascites, increase in the hematocrit level. Please be so much careful with this one. Increase in the hematocrit level, because the hematocrit level is the one that will direct us towards the management of dengue. Okay, and there is gingival bleeding, petechiae, and epistaxis. Okay, so there is a dengue with warning signs. So dengue without warning signs, dengue with warning signs. Now we move on to dengue hemorrhagic fever. In the dengue hemorrhagic fever, what you can see is, you can see that there is a reinfection with a different serotype. Okay, there is a reinfection with a different serotype. There is increase in the hematocrit level. Now see here, there is a reinfection with a different serotype, occurs after the fever subsides. Okay, now temperature may be hypothermic, or second fever spike may be there. Suppose if there was a fever and this fever came to an end, again there is a spike of fever, then think about a dengue hemorrhagic fever. Okay, think about dengue hemorrhagic fever. Now what you need to understand from here is, the most important factor from here is evaluation. Now see here, so there's a severe hemorrhagic manifestation. In the severe hemorrhagic manifestation, what is there? There is petechiae, there is ecchymosis, there is purpura. There is petechiae, there is ecchymosis, and there is purpura. And remember that this petechiae, ecchymosis, and purpura is there. Along with that, there is thrombocytopenia less than 1 lakh. Now we have to be careful, because there will be severe bleeding manifestation. So there is already petechiae, there is already a purpura, there is already a ecchymosis. So there is petechiae, purpura, and ecchymosis. Now let's talk about the other factors. In the other factors, you need to remember that the hematocrit level decreases in the case of dengue hemorrhagic fever. There is hepatomegaly, there is liver failure, change in the mental status, and respiratory distress and ascites. All the features from here, you can also add it over here in the dengue hemorrhagic fever. So is this clear till here? So are we clear till here? Yes. Now let's talk about the dengue shock syndrome. So in the dengue shock syndromes, what should we understand is, dengue shock syndrome, if the patient is in hypotensive shock, so he has dengue hemorrhagic fever plus there is shock, so this is known as dengue shock syndrome. So it's a severe hemorrhagic dengue plus shock is known as dengue shock syndrome. And here what you can do is, you can go for a serological test, that is the diagnostic. For the diagnostic, that is a serological test. For the dengue, you can go for a diagnostic test, that is serological test. You can go for ELISA to detect IgM, okay. And then you have NAAT. So you can also evaluate for NS1 antigen, also evaluate for NS1 antigen, okay. Now NS1 antigen is the initial factor. Someone is having dengue, and you have to look into the NS1 antigen that can be detected directly after the onset of symptoms, before even the IgM production. So basically, the onset of fever is there, and then you have the IgM spike. In between there is a NS1 antigen elevated. Now this NS1 is the one that you have to perform 7 days after the symptom onset, okay, very good. Now if dengue NS1 is negative, it does not rule out dengue. What you need to do is, you have to perform serology, that is IgM serology must be done, okay. So within 7 days, you can just, like, for example, there was a fever today and you're suspecting dengue, then go for an NS1 test, okay. That's clear, very, very clear. Now if you are suspecting that, yes, there can also be other feature, just go for an IgM, okay. Just go for an IgM. Do not use corticosteroids in the case of dengue. It will worsen the bleeding manifestation, and the hematocrit is the one that will decide our judgment. Hematocrit level increased means the susceptibility towards dangerous component has been decreased. So our main aim is whether or not the hematocrit has increased or not. So if the Hematocrit has not increased. If the hematocrit decrease, then we have to go for ICU administration. We have to go for packed cell volume transplant. We have to go for a blood transfusion of the packed red blood cell. Okay, so now let's look into the management. Okay, so first of all, let's talk about the do not of dengue. So do not of dengue is so do not use corticosteroids. It will increase the risk of GI bleeding, okay, immunosuppression, hyperglycemia, and do not give platelet transfusion for low platelet count. So if there is a low platelet count, do not give BT. Do not give blood transfusion, okay. Now, do not decrease the risk of bleeding may lead to fluid overload. Okay, so whenever you transfuse platelets, it will lead to fluid overload as there is already leakage into the third space, and this will worsen the condition. Okay, if the platelet count is less than 1 lakh, then only you can go for blood transfusion. Else, if it's associated with severe bleeding, then go for blood transfusion. Else, no need of blood transfusion. Okay, so what is our major motto regarding dengue? What is our motto is, so do recognize the critical period, monitor fluid intake, vital signs, hematocrit level, and give packed red blood cell or whole blood for significant bleeding. Okay, now, so colloids doesn't leak outside. So just remember that whenever we talk about dengue, how are you going to treat dengue? So someone who is having a dengue with warning sign, here you are not going to give corticosteroids, do not give platelet transfusion, tourniquet test can be done, corticosteroids do not give. Okay, blood transfusion is done if there is less platelets or there is severe bleeding manifestation, right? Same thing is written over here. Just give paracetamol and rest. Adequate fluid diet, nutrition. Okay, now if the patient is not able to eat, okay, is in shock, this management does not work. You have to go for this management. So if the patient is in hypotensive shock, you have to give crystalloid, and if it's improving, then you can continue crystalloid. If it's not improving, just measure the hematocrit. If it has increased, then continue with colloid. Okay, so it has gone towards this side, but if it's not, then go for packed red blood cell transfusion. Okay, now in this case, dengue hemorrhagic fever, hematocrit level decreases. Okay, and if the hematocrit level decreases, you know what to do. Hematocrit level if decreases, then you have to go for fluid transfuse. Okay, so crystalloid must be given. If hematocrit is increasing, give controlled crystalloid. But if hematocrit decrease, then transfuse the packed red blood cell. Okay, and you can give ringer lactate as a crystalloid. It's very good, and you have to slowly increase ringer lactate. Okay, do not give as a like IV bolus, because it will lead to fluid overload. Okay, never give aspirin, ibuprofen, because these are NSAIDs. This will increase the risk of bleeding. Prevent dehydration, give ORS. Okay, and in a stepwise manner, we are going to increase the level of the fluids. Okay, so this completes dengue. Thank you.